tumor or a cyst in the knee area. We are understanding more and more about telomeres, one major role in changing our structures, and especially ligaments and bone structures of knee structures. When we want to understand the knee injury, we have to focus on the ligaments and also on the kind of the meniscus anatomy. The meniscus anatomy is very much involved in the blood supply. We have different areas of the meniscus which we can address in a surgical way, but there's others which we have to resect. And the definition and the importance of biological age comes into play. Especially when they come from ballet training or other hyperlaxity activities. We have to focus also on the muscle strengths. We have to detect muscle comorbidities. You can also face sarcoma or other myoplastic injury and comorbidity. Especially for the middle-aged patients, overlaying of root nerve problems can be evident. It can occur especially in hip problems like impingement, but also in knee injuries where L3 and L4 conducted root problems can overlay the findings which we can do under the physical investigation. We usually do a sampler anamnesis, and when we do the first investigation of the patient, we have to see which drugs they have, how the general conditions of the person is, and then we go to specific X-ray or even PET. From Australia, we can do the first aid in a different way, and we can talk about more of safety first and injury awareness. For elderly patient, we focus more on mobilization without weight bearing, like underwater biking, or we have treadmills where we can suspend them into a bending device to reduce the load after running belt therapy. For us, the main thing is a face-to-face therapy. So we and physio devices. We focus mainly on a face-to-face therapist intervention. Which factors influence this procedure? It's mainly also the impact of drug abuse, especially in a non-professional area. We have quite a high use of antiphlogistic drugs during interactive communication with the patient and how they really conduct our post-surgery program. With plasma therapies, we learned that we can also bring growth factors to areas of the body which are not so well supported by vessels. That's especially the meniscus. It could be some joint areas or some attachment areas which can improve by the growth factors which we find in part of the plasma in the blood. We can use autologous support. The long term is definitely how they follow up specific guidelines to prevent further on ligament injuries. Recommend them to use at least their cleaning of the teeth in the morning and the evening. So we have 10 minutes of time which they can use easily for training during the day. The age-appropriate exercise is tailored by the physicians, and it should lead to an injury prevention. And the tailored surgery, which I will show you in the next slides, is part of this specific treatment. The cruciate ligaments are quite complex, and they are supported by 4 tendons on the medial side. So it's a more complex thing that you might consider at the first sight. The function of the cruciate ligaments can be addressed as a sliding belt to prevent the upper knee from going forward, and from different sides also the backside prevention. But we have a lot of different structures, as you can hear, the tendons from the medial side, which has also very significant impact on the rotational stability. In some years, we mainly used these ligaments and tendons to reconstruct the cruciate ligament, but now learning that especially for football players, it makes more sense to use the quad muscle as a non-rotational activating structure. The mechanism, especially for the direct trauma, is usually a fixed position of the leg, where an opponent pushes the leg to the medial side, rupturing the medial collateral ligament and the cruciate ligament partly or completely. It can also happen when the patient is turning around the fixed non-activated leg. Especially for the cruciate ligament reconstruction, we have now also a part reconstruct these bundles, increasing not only or preventing the sliding, but also increasing the rotational stability. For the MRI, we are focusing mainly 3 Tesla MRIs to have a good sensitivity of the structures. In some cases, we have 9 Tesla MRI available, especially when it comes to additional cartilage injuries. The postoperative planning is be addressed in the next weeks after the surgery. The surgical reconstruction techniques for the cruciate ligament could be autograft. This could be a tendon which we take from the person itself. It could be allograft, which is mainly taken from a passed away person and degenerated, or we can select different reconstructions after previous surgeries, as you see it down on the left, where the canals had been enlarged due to post-surgical problems. This picture can show you quite easily how the cruciate ligament For the arthroscopic procedure, we have a bunch of different fixation devices. Some are resorbable, some may stay in the bone, and we decide according to the demands of the patient and the size of the knee or the age of the person which kind of construction we can offer. Focusing of manual drain therapy, it was a big advantage actually to focus on the soft tissue after the surgery. Arthroscopic surgery, you might have a higher fluid turnover in the joint, and you have to bring out this higher content of water out of the joint to have a proper rehabilitation and movement. We continue then with clinical testings, sometimes with imaging controls, and of course with patient-reported methods. The return to sport protocol was previously mentioned, is one of the key factors to bring people back to their sport level, which they have done before the surgery and before their injury. Improved surgical techniques have given us the possibility to differentiate between different joints, different conditions, and different goals of the patient. Often we have to injury as the cartilage is compressed or ruptured or even disordered. In the late 80s, there was a technique offered from Hungary where Mr. Hungary started to drill specific cylinders from one part, you can see it in the left upper part of the picture, to the main loaded area of the cartilage of the femur. The so-called OATS system is a system which we used at the beginning of cartilage surgery, and it has still in smaller defects, we learned that we can also collect cartilage particles with a specific shaver. These cartilage particles are then saved in a device where we can reuse it for the patient, and then we can put it back into the gap between the cartilage defect and the epichondral structure. Often these cartilage defects are healed with a degenerated cartilage. It's often not possible to recreate a hyaline cartilage, which has a kind of a Gothic architecture. Sometimes the cartilage has a different and less load quality, and that's also the reason why we are still restricted in the size of the causes of damages are also according to the elasticity of the cartilage. There are a lot of treatments which try to improve the water content of the cartilage to make it softer, give it more elasticity. And these hydroscopic substances which we might inject into the knee, they can improve this cartilage quality for quite some time. And also, older idea of cartilage reconstruction and improvement is a drilling system where we dissect cartilage flaps and then use a drilling mechanism to open the bone marrow to get bone marrow cells, which are kind of stem cells, where the stem cells are produced, growing into this defect and have the capacity to have a cartilage regeneration. The first chondrocytes, which had been also cultivated in laboratories, previously taken from the patient and cultivated in the laboratory and then secondary implanted on a scaffold, was also done in the 80s. For example, in Abano, I remember well when we went. Centimeters. So the new techniques involve more structures which come in spheric probes, and this spheric can improve the size of cartilage. Here you can see scaffold which can be seeded by stem cells and put into the defect. Also, depending on the load of the knee, especially behind the patella, it's still a challenge to reconstruct cartilage because it's difficult to unload this part of the knee. The bone marrow possibilities we gained during the last years can be also done from the tibia head. So we can do it in one procedure. We open the bone marrow with this cannula, make more or less cracks into the spongy bone and aspirate more or less stem cells with blood contents. These stem cells can be processed and also seeded into the scaffolds, and maybe in future we can also bioprint specific structures for attachments, meniscus and cartilage areas. Here we can see around which defect sizes which can treat at the moment. So with the hyalofast, this collagen scaffold, we are up to 4 square centimeters, and with the spherox, these spherical structures, we can do about double the size. The sensors after cartilage reconstruction are important. We try to unload the areas during the first weeks, and we will hear here topic. The success rates are promising. There's a nice pain relief available, and also the long-term durability studies show an integration if the cartilage defect is not too big and too involving. The next step, of course, is a hemiarthroplasty, which can be also done from only for one side of the femur, or a total knee arthroplasty, which is also available and make sport activities definitely possible to a specific range. The conclusion about cartilage reconstruction, we can say that we are on a midterm success. Or facing a total replacement of the whole surface. The meniscus treatments, when we come to the next structure in the knee, which is the most injured part, especially the medial side, because it's more fixed in the knee joint, we started with open techniques, which were not very successful at the beginning, and now we come. You see the load of the meniscus, which is especially in the medial part quite significant during movement, and the different ruptures we try to prevent. This is the reason why we also recommend people with a smaller grade 3, that means a rupture which comes to the surface of the meniscus, to get the meniscus sutured, because we know that they can be impinged between the femur and the tibia and then lead to a larger injury and the right bottom side. There are mainly two different techniques. First, of course, we need a diagnostic to see how the meniscus injury can be addressed in an MRI or ultrasound investigation, and we have to be aware that only parts of the meniscus are sufficiently supported with blood, so we can make a suture in these areas. Usually we try to suture more or less all meniscus and make a combination between the resection, which you can see here, and we try to do it from an outside-in technique. This is this technique like a side-by-side barrel, where we use needles, a very cheap procedure, or we take more advanced resorbable techniques where we can do everything from an integrated access and guiding people through their injury. It starts actually with the previous training and safety awareness in specific sports, but it should be a multinodal approach which can help the patient to be guided through an injury and go back to the original level of sports activity. The whole person treatment, I think, has a very interesting aspect in the clinic as we visited yesterday. There's a lot of different departments which can help the sport active persons to be treated, from the internal medicine, from the general surgery, also from the teeth department. We know that some teeth problems can cause quite a significant chronic infection of the body, and especially when it comes to replacements, total replacements, we definitely need the teeth department to have a good teeth status. And also when we treat people with osteoporosis, we have to know if they have implants and which kind of teeth disorders they have. The difference between traditional and holistic have this restrictive focus on their own department. We communication between especially the therapist and the radiologist is essential. We call it this musketeer approach, where you have the surgeon with the arthroscopy in the knee above, and you have a radiologist, you have an internal sports medicine specialist, and you have a specialist for physiotherapy working together in the specific case. And this should be the multidimensional patient assessment, where we connect the diagnostic, the physical evaluation, and also the psychological and emotional considerations. I just mentioned before that disorder when it comes to injuries, and they have a high pressure of the team and the trainers to return to sport, sometimes too early and not according to our medical guidelines. But the nutrition impact, the sleep patterns, the outcome of our surgical interventions, and this could be an integrative treatment strategy which increases the effect of our minimal invasive procedures, our regenerative medicine requirements, and also the tailored physiotherapy, which then can be part of the mindfulness practice and also patient education, how they can prevent further injuries and increase their level. These are the benefits actually of holistic approach, and assets, a long-term well-being and a sustainable performance according to case studies and a good environment to develop their goals. Supported also by 3D imaging. Now we do also robotic assisted surgery, which we just started in. And the implants to improve the target medicine and regarding also the lifestyle factors of the patient. Thank you so much for your understanding and your time.
The last time I stood in front of such a large audience was during my professional handball career, where I have supported and motivated my team as a goalkeeper. Perhaps I can do the same for you today. So first of all, I want to go into who we, the Wearable Technologies Group, are. Most of you perhaps don't know about us, what we do. We help companies with consulting, we help with going to market support, especially for startups and early techpreneurs. And we organize networking events around the globe, fostering wearables into the healthcare and medical space. So, do everybody know? Do everybody know what a wearable is? So, a wearable is a kind of a sensor you can wear close to the body, or on the body, or even in the body. So, the aim here is to define wearables as a term. So the amazing wearable market is in some segments more growing and in some segments less. But everything starts here from the sports and then goes with the wellness. Also we have then medical applications, industrial applications, and yes, to make a wearable it should be also a fashion one. Sorry. in the wristables, and we will see also some declines in some other categories, because as soon as a new category comes in, you will see a decline in another category. For example, smart rings. If you have a smart ring, perhaps your nice smartwatch could be a bit obvious. And therefore, we see a big increase in the smart ring market from everywhere, from India, from China, from Europe, especially here from Europe with Aura. But I will cover the smart rings now directly here and go further in this presentation. These silence killers were responsible for at least 43 million deaths globally. These numbers of the 5 illustrated NCDs underscore the critical influence of behavioral risk factors such as tobacco use, unhealthy diets, harmful alcohol consumption, and a lack of physical activity. These behaviors are shaped by our social, commercial, and physical environments and contribute to key metabolic risk, including rising blood pressure, obesity, and high blood glucose levels. However, there is a powerful ally in this fight: physical activities, sports, as already mentioned many times today. Promoting healthier behaviors and environments can make a substantial difference in combating these diseases. Engaging in sports not only counteracts these risk factors by improving cardiovascular health and managing weight, but it also holds potential for preventive health care. And as we continue, I will coming from the negative extreme to a very positive extreme, targeting an unrepresentative but highly different group, women's health. Women's health in competitive sports. So Laura Philipp, a German triathlete specialized in long-distance races, has run 3 Ironman. Health and bone health. Therefore, she misses a lot of female information. So therefore, I ask myself, would have additional wearable technologies help triathletes in Hawaii to achieve greater efficiency? So who among of you is wearing a watch, a smartwatch, a wristable, or for example also headphones or earbuds? So what are those categories here in this graph? Coming from the right. Late maturity. It must work, it has to work. CGM patches are currently introduced to the high end, also in this market. Everyone is aware about CGM wearables, especially among diabetes patients. But where are we? Many smart patches are still in the early adopter state. So you could do a lot of business there, but it's possible that after 2 or 3 years, your product may not longer be meaningful and it will be removed from the market. So ECG patches, temperature monitoring, all that is still at a jump for the next 1 or 2 years. However, it's not longer available because it's widely known among doctors and physicians that they can be used as an alternative as ECG holster. And in the early adopter market, people are also asking you a lot about what science is inside. Therefore, we have established 4 categories. We have this here on the left-hand side, the non-invasive monitoring smart patches, which include some classical with the analog and optical sensors, a PPG sensor, for example. Then also we have the non-invasive biomarker sensors, which are still in the research phase, biomarkers in sweat or saliva, from the most accessible non-invasive window into human health. We also have in the next category to the right, the electrostimulation patches. Some devices have been there around for some years or many years, but getting now smaller and smaller and more intelligent. Therefore, we will also last longer in terms of energy usage and have access to easy remote therapy opportunities. On the opposite, here to my right, we have the invasive patches. Most of the patches are disposables and must be renewed. Finally, we have the category of transdermal transmission patches, and as you know, they must undergo extensive clinical trials before implantation. So starting with a very famous and well-known the Abbott Freestyle Libre, continuous glucose monitoring, and the Omnipod Dextom, an insulin delivery system. These technologies represent a leap forward in managing chronic disease like diabetes, offering real-time health that empowers users to take a diagnostic control of their health. An important part is the closing of the loop. In diabetes care is the automation of both devices for standalone healthcare application may be a step forward. Nevertheless, those devices are not only intended for diabetes care. You could also use them simply for sports and wellnesses. Here, the Freestyle Libre transformed to Lingo and goes beyond health care management and provides a lifestyle solution and adapts sports settings. Now, Abbott is with Lingo really venturing into the nutrition market. At the core of this advancements, we refer it as a disruptive smart patch. A patch that redefines wellness and sports management by delivering precise health data and enhance both lifestyle, sports and performance. Lingo was presented for the first time last year. So further on with health management, we have here from Innovosense, a US company, with a non-invasive smart patch, a nutrition management. On the left-hand side, you have the HydroSense, which gives you a valuable insight into sweat loss. Monitor vital minerals lost through sweat with HydroSense to prevent cramps or maybe fatigue. On the right-hand side, the Smash analyzes direct loss of metabolites such as glucose, ketones, lactate, or cortisol from sweat. So thinking back to Laura Phillips, who managed to get in 3rd position this year, because she took even better care of her body conditions during the Ironman competition than her 2 predecessors. May her competitors have used a smart patch like this or been warned beforehand of massive sweat loss, or would they have made a precise intake of electrolytes at a suggested time after the first metabolic loss? The race could be ended different maybe. Or maybe directly question to you, Professor Pogazzi, maybe this could also be the legal doping of the future for the triathletes, who knows. So further on, we have another Swiss startup who who is adopting its minimally invasive system to provide insights into hormonal balance and proteins, which is a valuable source of information about, example, for the women's cycle. Also here mentioned Laura. As she noted before, this is the highest retail sign to have a natural cycle. On YouTube, she offers some free advice and insights on how she is listening to her body and adapts her nutrition and sports behaviors according to her feelings. So maybe a wearable like this could handle that automatically and could give her precise and intelligent advice nearly in real time. So changing the category to an in-body worn wearable accessing non-invasive metabolites in saliva. With the iTooth, I introduce you to a cutting-edge innovation in health monitoring. This Swiss-made device provides real-time analysis of your lactate level directly from the comfort of your mouth. This cutting-edge technology is powered by CSEM, state-of-the-art biosensors, and low-power, miniaturized electronics seamlessly integrated with a dental material and design. Here also topic change, so Adam, an asthma patch that transforms respiratory care. The FDA-declared device detects symptoms by counting coughs, taking respiration reads and heart rate, and even recognizes inhaler use. This small patch, again a wireless telescope, continuously measures lung capacity and lung function. As the world's first ambulatory cough monitor, it proactively warns asthma patients before an attack can occur, therefore promoting timely medication use. Coming from respiratory issues to back pain. And so, also an US-made TENS device enables reduction of muscular pain through transcutaneous electrical nerve stimulation and improves muscle activity. The ENSO went public this year in May and is FDA approved. It's very intelligent, so the small TENS device has here enough energy for the whole day to treat a patient with unique waveforms, the electrical pain relieving signals. These waves are delivered as safe impulses through the skin that works on your nervous system to reduce pain. Conversely, we have here from Adamant Health, which also utilizes electrical signals to monitor the movement disorders. These disorders can maybe occur when patients are unable to work normally on your own, and symptoms like this can occur from Parkinson's disease, also called bradykinesia. So in this case, sports medicine and that suitable wearable could also maybe a palliative solution for the patients. This CE-marked EMG and data analysis technology from Finland provides a detailed and accurate symptom data, helping patients through personalized treatment and informed treatment decisions for the clinicians. So here we have also, regarding some movement disorders, a wearable from Neuroscientis, also a US company. It is developing an EVS stimulation system and a vibrator sensing system, which with electrical vestibular stimulation, so behind the ear, showcasing here on the right, a specialized form from very low-level neurostimulation is applied to the recovery of the patient. The vibrator sensing records both normal motions characteristics of healthy individuals and the pathological motions. Together with machine learning models, vibrator sensing and EVS stimulation can enable a closed-loop system comparable to the earlier mentioned theranostic system. So coming to my last wearable with electrical signals for therapy approaches from Flow Neuroscience, a Swedish company. Flow utilizes a technology called TDCS, or transcranial direct current stimulation. This has used in clinics for over 25 years and has been proven safe and effective in multiple independent trials. This CE certificated wearable guarantees a treatment to reduce depression symptoms significantly within 3.5 weeks, up to 75%. Now I jump back to well-established wearables from the late maturity category as shown before. Wristables encompasses a wide range of smartwatches, fitness bands, and other wearable devices that can be worn on your wrist. Here, with the Hilo Band, I have a CE plus FDA-marked validated wearable from Switzerland, co-developed with CSEM for blood pressure monitoring without a cuff, continuous blood pressure monitoring with the PPG sensor with a mean error of plus minus 5 millimeters of mercury. Also, to sum up, this is from the late maturity consumer solution and has recently received FDA approval. The Apple Watch 11 series is pioneering new fashion wearable in health monitoring with its hypertension notification system. Additionally, for even fast heart rate measurement, users can employ the electrical heart sensor by placing the finger on the digital crown, capturing real-time readings each second. So within this a little bit crowdy slide, I want to showcase how wearables are becoming commercialized for the healthcare sector. So how medical products uses in fashion wearables, from finger pricking to continuous FDA-approved blood sugar monitoring, or even available for fitness lifestyles in nutrition management, or from a cuff to a cuffless wristband blood measurement. So, or from your iPod, which is nearly invisible, and then now a hearing aid. Even more healthcare products leverage the consumer electronics methods and become an over-the-counter medicine. Therefore, it can be used as personalized prevention freely from everybody. Vice versa, the counter market with fashion wearables is also looking to reach the secondary healthcare market and will reach FDA approvals for their devices. So let's see who gets to a trusted and fashionable medical product faster. So now, after after you have seen a lot of wearables that are close to being to a medical product or are commercially available, I would like to introduce you to an EU co-funded research project that we, the Wearable Technologies AG or group, are part of, and for which I'm responsible in project management. This European project initiative is called as H2Train, so short times, 2 times health, H2, and 1 time intelligent training is going to set new standards in integrating health and advanced training methodologies. With a powerful consortia of 35 partners from 7 European countries, H2Train is supported from the European Union with a contribution of 7.2 million euros. So the core objectives that H2Train project aims are toward to a future marked by innovation in health and training technology. Firstly, we commit to develop a novel graphene oxide-based biosensor. Next, a comprehensive multi-sensor system is integrated to embedded intelligence. And then the key aspect of our project is to integrate a ultra-efficient radio frequency and thermoelectric energy harvesting unit to store the energy. We are focusing therefore also on the advancements of textile integrated supercapacitors. Lastly, we are constructing a sophisticated system for IoT-based remote assisted living, sports coaching, and post-surgery monitoring. So finally, I want to tell you that you maybe do not miss our events and stay up to date about the latest innovations on wearable technologies, or about our next big event in November in Düsseldorf, Germany, the Medica, the world's largest healthcare, where we are a significant part with our WT pavilion. Here we already warmly welcome Professor Harisi and Professor Bache as a speaker, and then later next year we will be also in Hong Kong, Sochu, Singapore, and again in the Silicon Valley. So with this, I want to close up my talk with a take-home question for you. So I want to ask you, what are your motivations for participating in sports, and maybe which wearable device could motivate you the most? So finally, I also would like to express my special thanks to Professor Harisi, Professor Bache, to the invitation here to speak to you. Also, thank you for the University of Business and Technology, the Kosovo Association of Sports and Exercise Medicine, the Kosovo Olympic Committee, the International Federation of Sports Medicine, and the SHAPE project for the invitation here. So thank you all for your attendance.
Thank you for the presentation. Last but not least, I invite Professor Dr. Edmond Harisi with the topic UBT Smart City, an integrated platform of emerging technologies and smart support for sports medicine, education, research, innovation, and clinical services.
Thank you very much. It was a long morning session, but very interesting. Thank you for the contribution. Really, a lot of things, a system of systems, and as university, of course, we have a lot of responsibilities to do everything in this direction, to educate people, to do new development, to do research output, doing innovation, prototyping, coming to clinical part, engage the community. So there is a lot of interactive approach in order to, let's say, consider that our impact is according to the, let's say, main responsibilities. And what we wanted to do, or we tried to do in the, let's say, last 25 years, or this 25 years of UBT, is exactly to contribute on this ecosystem approach, then specific fields like sport medicine to find their way in order to have better, faster, let's say, impact on different. So in order to do this, so we consider that should be a convergent system, which we call Smart City. We are trying to present this as a model, not only for sport medicine, but as a platform of, let's say, academic system, which could be. I will try to have 10-15 minutes, not to take more time. I know there is a lunch time, but especially for some guests that for the first time are here, so maybe to show. Otherwise, we have interact on this part. I call UBT Smart City an integrated platform. I think it's a conclusion to let's say come back to your positioning, your recommendation, your confirmation, and the trends you proposed, and see how we can react fast and not very late with this part yeah. Okay, this is the conference. My background is I'm professor of system engineering, so working and have more aging in the process. So I'm very much interested in complex system, in transdisciplinarity approach. So my focus is very much to link different disciplines together and to create a system of system, as you mentioned, Annika, in order that this fit quite well harmonized and have better impact. This is my interest because of my background in engineering, computer science, and business and specific fields. I think this can be like a architecture for different systems. We are in this convergence revolution. I think what I wanted to mention many times now in the last 3, 4, 5 years, because it's, I think, from my understanding, it's a convergence of knowledge. It's not a very new knowledge, to be honest. So this is when I studied in 90s, and ADIS, and so the different signal processing, different interaction are the same basic laws that we have as of today. But we increase this integration, we increase the complexity, we increase the speed, and I think it's a perfect match to, especially for young countries and young institutions, to be part of this interaction of knowledge, which I think it's as the way how universities and institutions should be able to interact. So not just at department level, not a component level, but integration. It's not easy from mindset of how we've been educated and how we do research and so on, but I think you should come from the system point of view, system thinking, and then moving to analysis or synthesis. So it is this I would try to believe on this format and to come building those ecosystem. There are a lot of elements why we should be here. We need to grow, we need to increase the quality of life, and this growing and quality of life improvement request another level of complexity which human-based, human productivity, but human also cannot do alone. So we need technology, this is for sure, and especially when we want to have some unknown, invisible level that we still does not touching. And in this case, I think all this transformation in the next years with ecosystem, with technology, with AI, with interdisciplinarity, I think is the field we are running and working and we should do on this. So in our approach is to have a small scale always, but very smart and self-sustained and ecosystem-based, innovative based. So it should belong to an ecosystem, but it always small scale for small scales organization. We have two propositions. We are working two propositions. One is that the physical space, the place-based of campuses should be transformed on innovation-based ecosystem. So not only university with education, research and development, but more components surrounding in order to consider a place-based, innovation-based ecosystem. We know what does mean. The second is this innovation small-based space to be a test bed for those what we are talking. So a kind of front runner on prototyping development, feeling, because this is not just technology, it is as a behavior, it's people, it's experience, it's prototyping, it's feedback of stakeholders implement. So this interaction should be somewhere, which most of the cases we don't have it. And we thought that the best area where we can really complete it, it's area around Science and Technology Park, around the university campuses, but with more additional functions, completing like a city. So those are two things. So how we can experience smart systems today. You cannot have a real smart city today because still it's very far from the real definition of smart city. What is the fourth industrial revolution, or what are the living areas and so on. So when you see by definition sport medicine, it's also an interdisciplinary approach. So we saw today different keynotes from different perspectives, a huge things to be completed, and I think this reflects that we have to have a background from technology side, from psychology side, from the health side, nutrition side, in order a clinical care, in order to provide something on this direction, providing education, providing research, providing development, and providing impact on this part. And UBT, we think, represent a test bed for such a interaction on it. Mathematically, it's a complex system. We say there is no algorithms you can copy, implement, and you finish your solution, the best solution, optimized solution. So in this case, there is always a continuous improvement and interactive part, and this is why we believe very much that AI-based algorithms with all this combinatoric level and high-performance computing will help us for all the levels you mentioned before, on cell level, nano level, micro level, policy level, climate change, health, nutrition, environment level. So all those things, when we want to touch, then we need to reach this precondition. So we have a clear strategy, which in the first point is transdisciplinarity approach. Then continue with sustainability, with excellence, with partnership, and the entrepreneurship and measuring. We called our system a 5S model, which belong with a smart infrastructure, because the precondition is to have a cyber-physical system, to work on side of resilience mindset, sustainable and innovation approach. Another side, always perform on excellence manner, according to excellence models, let's say. And on those side, knowledge, interaction, open, and harmony between people and technology. So this is a 25 years project to reach this ecosystem. Then, in order that this all are made based on system design, and system of system design, based on best practice, life cycle based design, user-centered design, regular feedback, user feedback from stakeholders. So this is how we are explaining in classroom how to deal with design and how to interact. So we tried really to place this, and this is the ecosystem. I think the complexity which we think we reach this level to interact. First, knowledge is about 150 areas of studies, which I think now we can come to the sport medicine from different perspective. Then labs for research and development, which for the moment we are above 200 labs, which I think we are covering most of those functionalities we are talking for sport medicine. But we have also developed different spin-offs and companies within the ecosystem in order to experience even clinical behavior or prototyping, developing for specific interdisciplinarity approach that we have. For example, nutrition, food, health, mechatronics, or psychology, EAG, NNS. So different interaction which can be part. A long view of entrepreneurship. So because Annika already showed us that this is now the momentum where creativity is coming into place, where many young people can generate different application. And but the point is, you create a highway of infrastructure, and they can contribute then with different interaction on this part. So we put it as the startup part and the campuses in one place. So the city. Living areas, we can monitor different behavior we mentioned before. The healthcare clinics is here, from the health check till hospital. So in this case, clinical part is covered now. Infrastructure with technology, with infrastructure is here. And then we go to the next level. So additionally, so food or research or production or creative industry or sport, education, and so on. So this is all now placed here at UBT Smart City, and you can touch those components in the same day in 10 minutes walk areas, so you can touch all those elements in one place. So I think this is our test bed, which according to this physical placement and Smart City 10 minutes walk, we have just created a framework of all generation from born day till end of life management. So I think it's youth, talents, sport, health, nutrition, before 5 years old, after 5 years old, going to university, then moving to professional development, which you mentioned, certification, diploma in sport medicine, going to enterprise, clinic, football match, sport clubs, and hospital, and then the community which is around those parts. So I think this reflects this test bed which we are able to interact in this holistic approach, as you mentioned, Doctor, or systematic approach, but also coming back to personalized approach, because there is an infrastructure to consider this. You see different fields. I mentioned here more related with health, medicine, and sport. Within the ecosystem, we have innovation ecosystem which supports. So for example, central testing is for testing, health check part. Then you have edu-technics, so the technology and education in virtualization, real-time monitoring, and different things. And you have different components which all of them, I would say most of them, will be used for sport medicine. They need to be used according to your presentation to this part. For example, 5G is needed to use if we wanted to have this real-time capability. If we wanted to check in a real time the heart rate, the oxygen things, and so on, so the intervention. So this is something you cannot test and build an equipment if you don't have a framework to test. So in this case, we create a test bed that people who wanted to design new variables technologies, or let's say another process in the sport medicine or health, they can go through this part. So I don't want to go, but if somebody has interest, you can see what is integrated or implemented here from the digitalization, from the system of systems. Cyber security is also an issue when you want to monitor, because somebody can also hacking your data. You can have disorientation on your advice. So a lot of things have to be really integrated in this process of service. Then you have sport, e-sport, junior hub for talent development, a research hub. Here an example that we create a hub for sport, e-sport, and talent development, which we provide from research to the part of evaluation, recovery, training, treatment, and examination. So there is now at UBT a platform which you can have the teaching platform, coaching platform, mentoring platform, and health platform. Or another side, you have the clubs from different size, different age. You can build within the ecosystem, because all generation you have here. Of course, we have as external people here. And then the related technology for different approaches, because if we are talking for digitalization, we have a software development center here. When we talk for neural network AI, we have it. If we talk for virtualization, we have, and also we work very much as in blockchain and things. So there is a technology platform to support different combination and efforts we are talking. So remote contactless, we have a program for any remote development in healthcare, and sport medicine is a part of, let's say, priorities. But as a tailor-made, you made it mention today 3D printing and different prostheses and things that you can work. So this is a tailor-made development program. We are working on it, and we have in this part. The creative industry would be maybe, let's say, fashionable-based, proactive in marketing and interaction. Central testing is an accredited testing area for one-stop shop testing for people, from product, and so on. And then you go to the technology, to digital innovation, to public policy, public health, simulation of different things, and coming back again to media, promotion, this health prevention, going to GIS with different spatial data infrastructure, and moving to the schools, to professional schools, to youth, and coming to virtualization, to community service, including as a health service. So this is our ecosystem, which kind of have a holistic approach within the one place-based system. This is not to replicate a city. This is just to have an opportunity to have a good education for specific purpose, testing and development, and of course an impact on this diversities. When we take just some of those parts out of this ecosystem, so we have now a general hospital with over 100 beds, with all clinics, and it's considered a university hospital. We have our own polyclinics, one-day service within the campus, with 22 licensed clinics, which 22 you can get in Kosovo. So any types with one-stop shop you can have. We have established the Institute for Sport Medicine, which is dealing now with a topic, sport lab, sport clubs now, sport, e-sport, and art hub, which is the platform for development. we have no an association of Kosovo, so a national level, and different programs related with it. So I think quite a lot of ecosystem components are now in place that we can move. From the digitalization, I think quite well established. I don't go too much because it's, but just to say that technology is here. It's not just to buy a component from one company, is the idea. Our idea is to give the talents people the right to develop, so they can use it and build it on it, but they should not miss any component which they are needed to create something related we are talking. Visualization, I think, is today and tomorrow areas. So we will have a lot of things on digital twin, digital heart, digital, so digital twin campuses, cities, and we are working very hard on this format. And then, also, first of all, in education, which create a very nice platform. And last but not least, the smart components of smart systems, which are integrated in this smart city system with cyber physical system and with integrated advanced technology. So you mentioned those technologies, and I would say most of them we have already here in place, which people, students, professors, and entrepreneurs can use for their purpose. I will not go more specific why this can be used in sport medicine. I think this is no time, but also it's relevant to consider that not everything we can now specify on sport medicine area for data acquisition, data analytics, data visualization, decision making, and real-time capabilities on this part. AI. We worked in the last year very much to have an integrated platform for all areas in one-stop shop for AI support, AI professor, AI students, upskilling, reskilling, entrepreneurship support, mentorship, and as you mentioned, Professor Bah, also these avatars, this joint action that you can interact on specific relevant areas. We consider that this ecosystem is the most integrated AI platform in Europe, as far as I know, and as far as why? Because we push very fast to have an integrated approach. So it's not because we are the strongest or the biggest, but there was let's say a mindset for a system and an integrated approach with less resistance. So in this case, we reach a smart city level by definition, and we have a test bed for smart city here in order to reach those components for education, for things. So for example, we have an area now for AI development platform. So we do different developments. So when you go to health diagnostic, we have also create a spin-off here with a health check via voice. So voice and coach, we take it, and then you have different parameters. Or, for example, we worked something with University of Harvard on a reverse aging. So we take the cells, imaging from them, we are learning the process, and we identify which cell is, let's say, older or if I can call dead or something, or healthy, and then you can create different reports and actions to have a faster intervention. But this is also on digital twin. I think now we work very much on digital twin, and as I see in sport medicine, we can also attract more and more developments on this part. So far, it's a place for different test beds. You can see different components that you find yourself from your perspective, from your view, what would be interesting. But as you see, neuroscience, we can do biomedical center, biomedical testing, telehealth, remote or service, e-sport, and so they are now things we do or we have already in place. If we take the list of sport medicine activities, all those parts now we already can or we are providing from the clinical point of view, from the physicians, traumatology, this is from the hospital point of view, cardiology, we have the best modernized cardiology and cardiology surgery hospital here in Kosovo with all equipments. And I think this is also very valid for sportists, and continue with let's say functionality in sport medicine. So for forensic, we have opened a professor institute for forensic and holistic approach of forensic, but within the forensic we have also the legal medicine. We have one of the best professor or the person here in Kosovo for medical legal medicine, which we are working, and he's head of the board, Professor Arsim. But then we move to other part, and including this toxicology, forensic, and so we can come closer as to the providing different feedbacks for doping, because we think we have already different laboratories related with the functionality which are working with the doping area, and we have different faculties from different perspective which they can provide. So schools, education, research, but also laboratories from different perspectives, which are, let's say, here. I copied from another presentation just to show faster to you as this component, because I think makes sense from this point of view. But this was the AI-based health check, what we mentioned. Then I will, and then the reverse imaging, digital twin. We complete a digital campus. So you see the sensors. We are moving and let's say adding more and more sensors. The sensors we are talking. Then we have created the cloud-based, in this case with Microsoft Azure, but also in a real time. And what is also important, we have already created a real-time visualization, which you can experience the same positioning of ours here on a digital twin, and we can measure, let's say, different parameters we consider when we are talking for sportists or we are talking for health or other. But technologically, let's say we worked very much. This is a platform where students are learning how to build a digital twin. Another site we publish from point of academic point, and campus is using this for, let's say, optimization or real-time decision making in case of necessity. So these are some elements we have. So the reason why we reach is because we have now really a real infrastructure according to the smart and self-sustained system, and we wanted to confirm or to motivate or to promote this a comprehensive, holistic approach with a kind of interdisciplinarity approach areas. It's needed for further development, for better short, let's say a bit faster competence gaining, but also doing those interdisciplinary development which we have. So we still believe on this format. We have a lot of impacts. We see the development. When we separate one to others, I think in a small scale we would not create this opportunity. So when we go just sport medicine and this we have to utilize, we have to combine, we have to create a system approach to be more efficient and more effective in a small scale. And I think this is as a message for small countries or areas which they need to cooperate, to coordinate their disciplines in order to reach some common goals. Otherwise, as an individual approach or departmental approach or function approach, I don't believe we can contribute that much on this direction. Even of course, we believe on specific deep knowledge and expertise on each subject. For this reason, we get a lot of rankings and confirmation and awards. We are happy for this, and we wanted to continue on this. So we get one of the best innovation campus for fourth industrial revolution, for AI, generative AI, for sustainability, for impact, for community engagement, and so on. So I think it's quite an excellence framework. So when we say excellence, we just confirm that we can confirm this excellence operation. When we go from resilience, we can confirm with different positioning on sustainable development, on sustainability education, ESG, and so on. When we go to smart infrastructure, we confirm with the smart city and those fourth industrial revolution. So this model we have discussing is already today confirmed as additional with specific standard and best practice from outside, because it's important also to see what all the things are talking. So this is I think a basement, a test bed I wanted to show to you, which I hope we can valorize different outputs and outcomes on education, research development, but also now on clinical service with a focus on sport medicine, where we are talking today. So thank you very much. I thank you all for great contribution. I think to summarize, would be very nice to open the discussion maybe for keynotes. If somebody want to ask, would be nice to give the floor to people. So maybe 5 minutes to complete. We can manage 5 minutes more. If somebody has a question, Milem, you had I think one, because we wanted to ask. Please. Yeah.
Okay, thank you. I will try to be short. I was trying to ask a question about for Professor Gobert regarding the surgery for high elite athletes. I want to know a comment between where is the red line of the decision to make a surgery or not make. I have a specific case with proximal hamstring injury, partial rupture, who is a golden medalist athlete, and she basically decided by herself to not take it and choosing the treatment, who could recover and in 5 months to compete in Olympic Games again. So what is the surgeon role here? How do you help athletes to decide, or they decide by themselves? This is my ongoing study, which I will present in next session. Thank you.
Actually, when it comes to hamstrings, it's always a question if it's a muscular disorder or a tendon disorder or ligament disorder. You can easily reconstruct the fibers of a ligament and tension fascia disorder, but when it comes to muscle ruptures, you're more on the conservative side, because you not easily can reattach the fibers of the muscle. So usually in this case, we are going more for ACP or PPR treatments and conservative treatments. Is it? Does it fulfill your question?
Yes. The athlete competes on the Olympic Games with 25% of asymmetry in hamstring strength, because she didn't take any surgery. She treat herself by just conservative method. So, is it a good idea to do that, or should?
How big is the gap actually of this disorder? How big is the gap of the rupture?
I don't get it. Sorry.
The gap of the structural disorder. How?
It's a partial. It's not completely rupture. Yeah. It's partial.
Okay, but anyway, if you're
it's tendon, it's proximal hamstring, tendon.
Okay, then a reattachment makes sense. If you can face the tendon gap, and then you can also refix to the bone original attachment point. In this case, we use small anchors. Can be a swive lock or a swive lock usually, or a push lock anchor. And this gives the regular capacity and reunite the whole structure of the tendon with the muscle function. Yeah.
Thank you. Any question? Please. Thank you, Professor.
Thanks to all the speakers for very nice talks. I got a question for Annika about the validity and reliability of the device testing lactate. Yeah, is there any data about that?
So about the iTooth, we also, thank you for your question. So we are also very curious. So on the website, we rarely find information about the tool itself. But if we have looked into the papers from the founder, from the CEO, so about, so this is a deposable patch inside, which needs to be removed. And inside the tool, there's also kind of a microelectronics. So coming from this thesis to the knowledge we have inside to that iTooth. Was this answering your question, or can I provide further information then? We can talk afterwards about this.
Thank you. I see a hand from student, colleague.
Thank you for the talks. I would like to ask Dr. Gobert. You mentioned some alternative medicine recommendations, I guess. What do you usually prefer in this, in your non-surgery cases?
Non-surgery cases on what topic you mentioned?
Yeah. Alternative medicine.
A non-surgical approach in which injury you?
Knee injury, arthroscopic or ligaments, whatever.
Right. I think, for example, if you focus on anterior cruciate ligaments, you have these two bundles. And sometimes when you precisely investigate the patient, you can sensitive instability in about 30 degrees of flexion, which relates to the anterior bundle. And in 90 degrees of flexion, you have acquired a stable joint, and also in the stretching position, of course. Then you can reconsider. Do you do a selective anteromedial bundle suture reattachment with a push lock, for example, to the notch, or you go more for conservative treatment? That's, for example, such a sample where you can decide. Or if you have a meniscus in a let's say grade 2 ruptured position, you might go according to biological age of the patient to a conservative treatment. Sometimes even if a base-related rupture of a medial meniscus in a mid-aged person, we can use instillation with PRP, ACP to the meniscus base, and or do just a needling from outside, which is a small invasive procedure, to create a healing process in this area.
Thank you very much. We are using actually PRP. That's why I would like to ask if you would recommend.
Of course, we have the next step of SVF, which is a kind of multi-functional cells from the fat pad, which we definitely like to use. Or you do the aspiration from the bone marrow, which is not even more invasive. It's just a cannula into the bone marrow and aspirate and use it as a much more effective cell application.
Thank you very much.
Thank you for your question.
Thank you very much. Thank you all. Thank you, dear guests. Thank you, professors, students, especially the honor speaker. It was great, and looking forward for the next step on cooperation and contribution. We will go for lunch. Here is a lunch break close to the session, and those who we will continue then 1:30 with a presentation from the colleagues who have published, let's say, apply for papers and accepted in the conference. Thank you very much.